welcome to today's Public Health Ontario Rounds presentation on measuring the climate resilience of health systems. My name is Elena McIntyre. I'm currently the Manager of Toxicology and Exposure Assessment at Public Health Ontario, and I have the pleasure of moderating today's session. Today, I'm joining from my workplace in Toronto, where I am learning on the lands of the Wendat, the Anishinaabeg, the Haudenosaunee Confederacy, and the Mississauga of the Credit River. I also recognize the enduring presence of all First Nation, Métis, and Inuit peoples on this land. I've lived throughout Canada from coast to coast, and it was the natural beauty of those places I lived that sparked my love of environmental science and shaped my career to bring me here with you today. I'm grateful for the environmental stewardship by Indigenous peoples who have always cared and shared for our natural resources to protect these places I've lived. And I'm grateful to now live and work on this land in Southern Ontario, land referred to by my child as the One Dish, One Spoon Wampum Belt land. Before we begin, a few housekeeping items. Please use the Q&A pod to enter questions for our speaker. A discussion and question period will follow the presentation. The chat pod has been disabled to limit any distractions during the presentation. If at any point during the session you experience technical issues, please email capacitybuilding@oahpp.ca. I would like to state that as the moderator of this session, I have no conflicts of interest. It's now my pleasure to introduce today's speaker, Dr. Peter Barry. Peter Barry is currently the Senior Policy Analyst and Science Advisor to the Director at the Climate Change and Innovation Bureau at Health Canada. He also serves as Adjunct Assistant Professor in the Faculty of Environment at the University of Waterloo. Peter is involved in a number of national and international collaborations to plan for climate change impacts, including Health Canada's Health Adapt, which assisted local health authorities across Canada assess climate risks to health and develop adaptation plans. Most recently, Peter was co-editor and author for the National Assessment Health of Canadians in a Changing Climate and served on the health advisory table of the National Adaptation Strategy. And with that, I will hand it over to you, Peter.
Oh, wonderful. Can you hear me okay, Elena? Great. Well, thank you so much for the invitation to make this presentation today. I think really is that, climate change impacts increase all across Canada. The importance of measuring our progress towards effective adaptation and building climate resilience is even more important. So I'm really happy to be here today. But before I begin, I just want to acknowledge that I'm joining you from traditional unceded territory of the Algonquin and Anishinaabe people, where I live and I work. So today we'll discuss why measuring the climate resilience of health systems is really important, identify some of the characteristics of climate resilience of health systems, discuss some of the existing approaches and methods for measuring climate resilience, and really importantly, describe some of the information and guidance available to health authorities to undertake these activities. So in terms of, why do we measure health system resilience to climate change? I think a really key and important starting point is our current knowledge of the impacts of climate change on individuals, on communities, and on health systems, some of the options to adapt. You might be familiar with the report, the National Climate Change and Health Assessment report that was released about a year ago now. And it really sought to answer the following question: what are the current and projected impacts of climate change on the health of Canadians and their health systems? Who is most at risk from these impacts? What is the status of health adaptation in Canada? How can we adapt to reduce health risk and to develop more resilient Canadians and health systems? And what are some of the knowledge gaps and research needs that really remain? And the impacts that climate change has on health really follow complex pathways. Really starting with upstream determinants of exposure and vulnerability on this diagram up in the top left. things like inequities or structural racism and colonization that interact with vulnerability factors or sort of influence vulnerability factors, things like gender, socioeconomic status, social infrastructure, and then interact with climate-related exposure pathways, things that you're very familiar with: extreme weather, heat stress, air quality, water quality and quantity, food security and safety, vector-borne diseases, and ecology sort of impacts. And I think what's really important is health systems, and relatively new in this equation. There's increasing recognition of the possible impacts of climate change on health systems, but also their really important role in mitigating these risks. And we'll talk more about that today in terms of building resilience. And so part of that assessment was a chapter on adaptation and health system resilience, and it really found that the effects of climate change on health and on health systems in Canada, they're already evident and will increase in the absence of more health adaptation measures moving forward. Canadian health authorities are undertaking a range of measures to adapt to climate change, but are really lagging in some of the really concrete climate change and health actions. So we have a health adaptation gap in Canada. Climate change impacts on health pose economic risk to Canadians, but efforts to adapt to climate change can be very effective in protecting health, and that's really important moving forward. The IPCC found that in their report, and the World Health Organization has indicated that this is the case as well. But this figure shows some of the areas, some of the really important programs, health programs that can be climate sensitive and impacted by climate change. So things like mental health programs, air and water quality, food safety, seniors health, travel medicine, occupational, a whole range of programs. And really, climate change can make these less effective moving forward. And sometimes you may not even know that it's having that impact if you're not monitoring this as climate continues to warm. So that's really important moving forward. And we're already seeing some of these impacts on health systems and health facilities. This is from the National Assessment. Some observations of impacts on health facilities. You'll be familiar with a number of these. So, for example, wildfires in BC, in terms of evacuations affecting facilities directly, even health staff. In the north, rising temperatures, melting permafrost, and requiring additional structural support for healthcare facilities. Certainly in southern Canada, ice storms affecting health systems, hurricanes in Atlantic Canada affecting health facilities as well. So, really wide range of effects that we're documenting now moving forward. And certainly adaptation by First Nations, Inuit, Métis peoples can really face some serious challenges moving forward in terms of health systems. So this is from the assessment as well. They reported that with climate change expected to have considerable impacts on human health, especially in northern populations, existing health systems may be strained beyond capacity to address emerging health issues such as pandemics. To withstand and respond to climate risks, it will be important to draw on local, Indigenous, and scientific knowledge to develop climate change responses that meet the needs in locally specific contexts and build capacity. And so, many health authorities, the good news is many health authorities within Canada and outside of Canada are really scaling up health adaptation efforts. So this is from the WHO recent survey that they did. It showed that about half of the countries surveyed in 2021 have actually done climate change and health assessments and have actually developed health adaptation plans. But the question is, and the thing that they're hearing back from a number of health authorities is, how do we measure whether or not we're making progress in protecting health, in preparing our health system, in becoming more resilient moving forward? And so I think it's useful to sort of really define what we mean by health adaptation and sort of starting to think about resilience. And so this is a figure I put together to try and really get to the core of some of the key dimensions in which health adaptation occurs, because it can be kind of complex or complicated. I think one of the key areas is in terms of this sort of looking from the outside in, and this is undertaking climate change and health assessments, identifying the programs that are really could be vulnerable. Developing your specific measures or your health adaptation plans in a very proactive way, and then undertaking a change in policy or programs or even new ones to address some of the risks. That's maybe a bit different than sort of broader health system planning that looks from the inside out and really starts focusing on kind of mainstreaming climate change into a wide variety of policies and programs within the health sector. Sort of a whole of health system approach can also be proactive, but again, starts from really on the ground within the health system and is informed by new knowledge, either indigenous knowledges or Western science. But I also think that increasingly with more impacts, we need to think about sort of a acute hazard response and recovery, where there may be more involuntary or forced adaptation, where there's urgent needs and perhaps a shorter time frame, and maybe a bit more reactive if we don't have the time to plan this out. So this could be less effective, and I think this is really important to keep this kind of adaptation in mind as well. And then, of course, at the individual level, undertake adaptation, which hopefully is proactive and planned and based on knowledge and perceptions of the individual, either at the professional level or the personal family level. It really depends on key determinants of health in terms of the capacity to adapt. And again, hopefully that's very proactive, but we do know that it might just be sort of this participatory adaptation that's maybe unplanned or responsive. And these are people that are at much higher risk and more vulnerable to the health impacts of climate change. And so proactively monitoring, measuring, and evaluating efforts to build climate resilient individuals, communities, and health systems becomes critical as climate change impacts increase, adaptation becomes more challenging, and the cost of ineffective measures rise. So I think the last points are really quite important, because we know that climate change impacts are going to continue to increase. I also think that adaptation, in some respects, is going to become more difficult for health authorities with increased impacts, with more demands, and that's something I think that we need to explore a little bit more. And so, because of this, the cost of ineffective measures, either the human costs or the economic costs, will rise if we're not. And so, the good news is there are many existing approaches and options for measuring health system resilience moving forward. This is from the WHO in terms of a definition of what do we mean by climate resilient health systems. Well, climate resilient health systems are those that are capable of anticipating, responding to, coping with, recovering from, and adapting to climate-related shocks and stresses, so as to bring about sustained improvements in population health despite an unstable climate. And so, if we dig a little bit deeper in terms of, what are the properties of resilience, really less than during and after an event, a heat wave, a wildfire, a flood, whatever the case might be. I think it's really the ability of a health system and community to withstand a disaster and minimize the impact. The ability of a health system and community to return to its pre-disaster level of functioning. But also really important, I think, from a climate change perspective, is the ability of a health system and community to withstand even more severe hazards in the future, because we're going to have more severe impacts. And also, again, from a climate change perspective, the extent to which health and emergency management officials learn from an event and use this knowledge to increase preparedness, because we're going to have surprises, compounding or cascading events that we need to learn from in terms of how do you adapt to those kinds of events moving forward. And so, I think that it's really quite important. And effective adaptation is really important in increased climate resilience, because it can mean the difference between, recovering worse than the previous state of your health system before, or even collapse, and recovering better than you were before, or even transforming your health system so that it's much more prepared for future climate change impacts. But, I think resilience building is really very important. And, health authorities, I think, can learn from really a number of important initiatives, looking at how to prepare health systems for climate change. So a couple of examples, I mentioned the World Health Organization survey that occurs every 3 years, and they ask a number of questions, really to monitor the progress the countries are making, or perhaps are not making in some instances, in terms of some of these really key activities that that need to be undertaken. And you've likely heard about the Landing Countdown on Health and Climate Change that I think has got over 40 indicators to try and monitor and measure this progress towards addressing the health of climate change. We've got a lot of examples out there that we can learn from in terms of our own efforts to monitor and measure our sort of progress towards resilience. And so there's quite a bit of new information and new guidance that's available. I'll share with you to hopefully perhaps guide some of your efforts. And so this is actually WHO guidance for climate resilient and environmentally sustainable healthcare facilities. So really focusing at the facility level here and providing advice to health authorities about some of the areas that they can look at in terms of resilience, climate resilience. So things like the health force, water, sanitation, hygiene, healthcare waste, energy systems, infrastructure technologies and products, but also the environmental sustainability of those areas. And it's a really great document because it provides candidate indicators that can be used to measure resilience or environmental sustainability, and some information and guidance on, well, look, if you find vulnerabilities in some of these areas, here are some options for addressing that moving forward. So this is, I think, in the Canadian context, this is quite important because a lot of health facilities in Canada have not started looking at the vulnerability to climate impact, and that's really important. That was a finding of the National Health Assessment. And this is a very recent report from the World Health Organization, guidance for measuring the climate resilience of health systems. So specific guidance on this, and it's really divided into three big areas, similar to the diagram that I showed before from the results of the Canadian Health Assessment. Looking at upstream determinants of exposure and vulnerability, and trying to measure what are some of the trends in these determinants that can really affect health. And they provide some suggested indicators around those. And I mentioned some of those previously. But also, really, really important in terms of this discussion, but also maybe the focus of some of our activities, looking at the climate resilience of health system function. Things like the health workforce, service delivery. Are your programs climate informed using climate change information? What about your emergency preparedness and management? Health and climate research is really important. Again, sustainable technologies and infrastructures, integrated risk monitoring and early warning. So in a number of these really key areas of building climate resilience for health systems, they've identified some example indicators that one can use, and some possible data sources that would need to be tailored for your specific jurisdiction. But really, that guidance about how to sort of frame this and how to start actually measuring some of these things. And then the third big area, obviously, are the outcomes of health system resilience. So the outcomes on health, the health impacts of climate change. What are the trends there? What are we actually seeing? And what are the impacts on health systems? And I provided some examples in the Canadian context of this. I think this is a very useful document. And here's just an example of some of the candidate indicators that are provided in this document. And they provide indicators based on the key areas of the WHO operational framework for building climate resilient health systems. You may be familiar with this framework. If not, I suggest you check it out. It was published in 2015, and it really identifies those broad areas of activity that can be climate sensitive, but also are really critical for preparing for climate change. And I've already mentioned a number of those. But what this document does is it provides these, again, these sort of example indicators in those different areas. So here the example is the health workforce, and it provides this sort of a scale or this measurement from low level resilience, medium resilience, and high resilience. And you can go through these. And the first one would be healthcare workers have information and training to protect their health and their patients from climate hazards. Is it a sort of low-level resilience where you really haven't started doing that? Medium, where you're in progress, or high, where you've really got that covered off. And we provide a number of these different indicators. Again, these are there are many indicators in the document. I think there's something like 80 or 90. You never use all of these indicators. I think that would be quite, it'd be comprehensive, but it may actually be difficult in terms of data. There are many examples that you can draw from, and you can sort of relate to your own jurisdictional needs. You can actually go to partners in workshops and have a discussion around what are the best indicators to use, and you can match these against the data that you have, and so I think it's very, very helpful in that perspective. And they also provide criteria for indicator selection. And I think you'll be familiar with a number of these criteria, but really useful to reflect on these when you look at how best to measure the climate resilience of your health system, of your health sector activities. Things like making sure indicators are specific based on the association between climate and health, actionable, related to climate and health conditions, environmental adaptive actions, measurable, understandable, applicable, and acceptable, consistent, comparable, robust, scalable, and such. And I think it's really going to be important to make sure that the indicators are meaningful to all users. For example, how could they be based on Indigenous knowledges and Western science? And it's really important, I think, to remember too that the climate change and health assessments can provide a lot of the baseline information for undertaking these measurements and monitoring the resilience of health systems, because they can provide information in all three of these areas: upstream determinants of health, impacts on health systems and adaptation options for health systems, and of course, health outcomes from climate change. Sometimes you can actually pull those indicators right from your climate change and health assessment, and some of the data, some of the actual results. So I think you really want to make sure that you link these particular activities. They shouldn't be separate. They shouldn't be sort of siloed activities, because there's a lot of synergies that can be had by linking them. And in fact, the latest guidance for undertaking climate change and health assessment by the World Health Organization, the last step is actually establishing an iterative process for managing and monitoring the health risks of climate change and the climate resilience of health systems. So it's actually part of the comprehensive climate change and health assessment process moving forward. And so in the Canadian context, we've got information from the National Health Assessment, I think, that can be really used to inform some of these activities. So in terms of some of the key steps that health authorities go through when protecting health from climate change, we can sort of overlay some of these measures onto those. So just going through the steps quickly, things like building the awareness of climate change risk to health and then to adapt is kind of a starting point. And then a number of health authorities will go through this, leadership and partnering, sort of building those networks to undertake that. And then some of the really groundwork actions in terms of doing the climate change and health research, doing the assessments, identifying best practices and analytical tools that one needs to get the information to really inform the adaptation. And then certainly one takes that information and moves into implementing concrete adaptation actions, things like new and upgraded infrastructure and technology, communication campaigns, health workforce training, you've already mentioned that, management of social and environmental determinants of health, climate and health financing, these kinds of things. And then certainly, and you'll be talking about this, we need to measure and evaluate the progress of these adaptation measures and do the course correction that's needed, sort of an iterative management approach to make sure that we're effective moving forward. And so in the assessment, we do have some examples, again, from the Canadian perspective, of possible indicators that could be used to sort of measure your progress in terms of health adaptation, but also in terms of building a climate resilient health system. So this is actually from that chapter, adaptation and health system resilience, and identifies a couple of areas here. It's a longer table for sure, but things like communication campaigns and what are some of the indicators around those kinds of activities, or leadership and partnering to address climate change and health risk. And what are the kinds of things that could be measured? Again, these would need to be tailored to your particular purposes, perhaps based on a climate change and health assessment that you've done. But they're a starting point for identifying useful measures to you. And the other thing that was included in that assessment too are actual some candidate indicators, again, from the Canadian perspective, on the climate resilience of health facilities, hospitals and clinics and whatnot. So again, things like the health workforce, whether or not your facility has undertaken a climate change and health assessment, and there's more indicators. So if this is helpful to you, I'd invite you to those. But one thing to remember is that we do need to make sure that we're effective in our very specific health adaptation measures as well. That's a really critical part of building resilient health systems, and you just want to make sure not to lose that really important component. But just got the example here of extreme heat and health, and we're right in the season now, and seeing some very severe heat events. Sometimes with wildfire events that we're needing to adapt to. And so it's a bit dated now, but the Health Canada Best Practices Guidebook for undertaking heat alert response systems actually provides some advice on how do you monitor the effectiveness of these systems moving forward in terms of process type measures, but also outcome measures as well. And so again, that's kind of a starting point for looking at very specific types of adaptation measures moving forward. And we do need to do more of that kind of measurement of the effectiveness of a broad range of specific adaptation measures. But we do have some examples that are showing that some of these measures can be quite effective. And so this is actually a study from Montreal. They showed, compared to extreme heat events before Montreal implemented their extreme heat action plan, the number of daily deaths has decreased fivefold, with the effect being most apparent among seniors. So that's a really big, positive measure of success. And so by targeting neighborhoods with low socioeconomic status, the plan is to reduce the gap in heat-related mortality between communities with high and low socioeconomic status. So that particular plan has really been able to help people that are at quite a bit higher risk from these heat events. But we also have other sources of, I think, useful information. This is actually the 2022 Green Hospital Scorecard Survey from the Canadian Coalition for Green Healthcare. And Health Canada has provided a bit of extra support this time around to integrate more questions on the climate resilience of these facilities. So this is one example of one of the questions in terms of, has your organization undertaken any of the following to be better prepared for climate-related emergencies? So again, offering training to staff, have an emergency plan, integrated climate change into emergency plans. That's really important. It's not enough to just have an emergency plan if you're not thinking about climate change and more severe impacts in the future. Developing a climate change plan for your organization. So that can be a really useful, I think, source of information to do some of this monitoring of climate resilience moving forward as we need to do. And another really important source of information, I think, are the increasing number of climate change and health assessments at local and regional levels, which provide that really concrete and local level information that I think is really needed to inform health adaptation and efforts to build climate resilient health systems. And so these are some examples from the Health Canada Health Adapt initiative that Health Canada led over the last 4 years, funded 10 health authorities across Canada. And there were some really great projects, 3 in Ontario, Northwestern Health Unit, Wellington Dufferin Guelph Health Unit, and York Region Public Health. So some really great information there. And we've got other health units that have done some really excellent work. Simcoe District Health Unit, Middlesex London Health Unit, Toronto Public Health. There's others. So this is really a vital source of information, again, that can be used to contribute to our thinking around are we making progress in terms of building resilience at all levels, the individual level, community level, and certainly at the health system level as well. And I'm really excited about this new initiative from the World Health Organization, the Alliance for Transformative Action on Climate and Health. This comes out of the COP26 COP26 program health commitments. Canada signed on to those commitments to build climate resilient health systems and reduce the carbon footprint of the health system. And one of the working groups for the Attach initiative is on building climate resilient health systems. And so there are a number of countries, I think over 60 countries, that are working together to exchange information about how to undertake climate change and health assessments, how to develop really robust climate change and health adaptation plans. And I think they're going to get into, how do we measure and monitor our progress in doing that? And so we'll be able to learn from those discussions, from a lot of innovation in other countries right around the world. And I think that's a really great goal. And if you're not aware, the WHO has also just fairly recently launched a new portal called Climate Health, and they're really trying to develop this international portal that brings together a lot of information that frankly is a little bit more difficult to find in the future because lots of different areas that you have to try and find this. And so it's got information that can help you, connect with the global experts on specific areas, find upcoming events, news, technical resources and data, certainly applied decision and learning tools, a number of case studies, and remember, this is all focused on health. And there's actually a particular webpage on health system resilience building. Also curated guidance and research documents, and you can explore specific country hazard and theme focal entry points as well with this particular tool. So I think this is going to be a really helpful resource for all health authorities from local. And also really excited too about the National Adaptation Strategy that was recently released, Canada's National Adaptation Strategy. A key pillar is health and well-being, and it has the goal of the health of all people in Canada is safeguarded and supported by climate resilient and adaptive health sector that is robust and agile systems and services that account for and support the diverse components of well-being. Also with specific objectives underneath that goal and targets as well. So, one of the objectives is that health systems have the expertise, knowledge, and resources needed to identify climate change-related risks and take equitable, evidence-based action to protect the health. And so, I think through the National Adaptation Strategy, there'll be efforts to really monitor how these objectives and some of these targets are being met moving forward. And you get that from this figure in the top right in terms of the adaptation cycle that really will inform a lot of these actions moving forward. I think this is going to be a really helpful mechanism for coordination, for information sharing, and for action. So I think maybe just to leave you with a few thoughts in terms of the path forward and thinking about how to measure the progress in building resilience. I think it's really important to start simple. So you can get, I think, overwhelmed quite easily in terms of either the number of indicators or the fact that one might not have data against some of those indicators, or just sort of framing the whole process in your mind. So use existing qualitative and quantitative methods to develop tailored measures of resiliency. So again, start simple, but also utilize climate change results, and in fact plan your new climate change assessments or your repeated ones. There's some health authorities that are on their second one. Health Canada is starting to plan the next national health assessment to be released, in 2027, 2028. And so, plan these to provide robust measures of resiliency and use the results again from past assessments. link these activities together to really build those synergies. We're too busy to be doing these things separately, not benefiting from these synergies. And as impacts increase, we're going to become even busier. So that's, I think, really important. Also, take an iterative approach. Expand the list of indicators, sources of data, and partners over time with new learnings, either within your own jurisdiction or from other jurisdictions, and with new data and resources. And learn from partners. Identify existing best practices and case studies that are relevant for your jurisdiction and tailor them to your needs. And it's really important to be inclusive, to make sure that you benefit from diverse voices, diverse viewpoints, and approaches, so that you can make sure that you're protecting everyone, and really maximizing equity and health equity through your actions. That's a really important thing moving forward. So I will stop there and just say thank you once again for this invitation to be part of this event today. Thanks so much.
Thank you, Peter. We will now move on to the Q&A for today's session. A reminder to everyone who's joining us, if you haven't had the opportunity to type your question into the Q&A pod, please do that now, and we will do our best to get through all of the questions. Luckily, Peter, you've left us quite a bit of time, so many thanks for that. To start off, I think this is a very good question to start with. The healthcare system and its workers have been under extreme stress since the pandemic, overworked, underfunded, etc. How do you suggest engaging healthcare workers in conversations about climate change and health system resilience when their capacity is already quite limited?
Yeah, I mean, I think that's a really great question, and certainly, I think this is an issue in terms of just so many things to deal with, so many pressures. Has been there for a long time. Certainly COVID has made this a lot worse. So I think we've really had to kind of address this, to try and address this for a long time in terms of bringing climate change and health issues forward. I've been in the office at Health Canada for 20 years, and this has always been. I think one way to do this is through engagement, and I hear from a lot of partners that undertaking climate change and health assessment can be really helpful with that, because oftentimes you will build a large stakeholder group that will participate, in some manner in that particular project. And then through that participation, they can sort of see their role and see why this is so important, why some of these impacts are actually going to put more stress on them. I mean, they're already stressed and working very hard, but if they don't start thinking about climate change, they're going to miss those opportunities, right, to take some of the measures that might help them avoid some of these impacts. So I think there are these activities that can engage these partners through communications products as well. But certainly there are major constraints that people have that can make even that participation difficult. One of the things that we're supporting right now that might be of interest is new guidance from WHO on communicating climate change risk to health. And certainly thinking in terms of the best practices, that's as I'm sure aware, it's been a big challenge for a number of years for lots of different reasons. But that guidance might be helpful in terms of how do you reach out to a wide range of partners, including partners outside the health sector, which are really, really important. Transportation, urban planning, energy, to really make the health case and be able to engage them as well. And so certainly that that could be of interest to people on the line today.
Okay, thank you. Next question. And this one is about Indigenous and Western knowledge coming together and what the benefits might be. Do you have any examples of two-eyed seeing happening in regions or areas in practice within a health system?
Yeah, so I mean, coming from the Western science perspective, it was a really well, it was a great privilege and a great learning experience to be the co-editor of the National Climate Change and Health Assessment, and to be able to work with a number of partners, including working the National Collaborative Center for Indigenous Health that led the chapter on climate change impacts on Indigenous people living in Canada, First Nations, Inuit, Métis people. So I actually learned a lot about sort of weaving Indigenous knowledges and Western science, and frankly, I've got a lot to learn. So, but I would just invite you to read that chapter because there's a lot of case studies of health adaptation that are Indigenous led, based on Indigenous led research that I think can be really helpful in terms of seeing how, in some cases, Indigenous knowledges and Western science have been brought together to inform really effective adaptation measures. I think something like half of the case studies in the full assessment, half of the 36 or 37 case studies are Indigenous case studies. So, we really put a lot of value on it. We heard from a lot of partners that it was really important to profile those Indigenous-led actions and to learn from them. And we can all learn from them. So I think I would have a look at that chapter because there's many that I think will be of interest to you.
Okay, so I think we're all making notes to go and review that chapter now. Next question. What's the status of pan-Canadian climate change monitoring or surveillance systems? Do these things exist? And what are opportunities for provincial or regional monitoring, if any?
Hmm. Well, our office has really, I think, tried to build some of the actions in terms of undertaking pan-Canadian monitoring and surveillance. And you'll know that there are some really important challenges in terms of doing that. And so I think we're, continuing to see where some of those challenges, where we might be able to make progress. So I think about 2 years ago, and I wasn't part of this specific workshop, but colleagues in our office in the data division held a workshop to bring together partners to look at, what are some of these challenges in terms of the sharing of information, in terms of, simply sometimes the methods of collecting this information. For example, the mental health impact from extreme weather events. How does one actually most effectively keep track and monitor these types of impacts, or even, heat impacts, right, in facilities. There's a lot of challenges there. So we did hold that workshop to really identify some of these challenges, and I think are looking for opportunities to be able to make some progress. But it's not something that I'm leading in the office myself. I'd be happy to connect you with colleagues that are. But it really is an important area that I think we need to. We need this more information. For example, for the next National Climate Change and Health Assessment, we've got really important knowledge gaps in some of these areas, like the mental health impacts of climate change. So I think it's a really important question.
Okay. We do have quite a few questions, and I'm noticing some patterns. So I'm going to try and loop a few of these together. Building on the question about surveillance, so about the previous question, are there initiatives or resources to support indicator development for organizations to then monitor climate change impacts and vulnerabilities? So for those, looking to move towards indicators, but really starting at the blank slate, are there resources to support that kind of development?
Yeah. So I mean, I think certainly the guidance document. There's a few guidance documents that I think are helpful. I didn't actually, and I think I should have. I didn't provide the Health Canada workbook for undertaking climate change and health assessments. And so, similar to the WHO guidance document, we developed a workbook based on a lot of the health adapt learnings from all of those partners. And I think that can provide some really helpful information. One of the things that we put in that workbook are actually fillable templates for each of the different steps in undertaking assessments that you can actually take to a workshop with partners or to meetings with partners, and they provide some of these either candidate indicators or just questions that you may wish to ask yourself in terms of undertaking a particular step of doing an assessment. What is the current disease burden from current climate, for example? So I would invite you to have a look at that, and Elaine, I'm happy to send them to that after the meeting or whatever's whatever is best. But I think that really gets into the importance of undertaking one of these assessments, or sort of a scan in your jurisdiction, because that's really how you're going to find out. Do you have sufficient data in certain areas of either infectious diseases, food, waterborne safety and security, natural hazards like heat, flooding, drought, these kinds of things. Where do you have good information about current risk of current impacts, perhaps projected impacts? Sometimes that's much more difficult to have that information. But the assessment process really lets you systematically understand with partners, sometimes external to the health system. Do you have sufficient information? And if you don't, it provides you with that list of research needs for the next assessment. So that's really important to have as well. And so I think if your jurisdiction has not undertaken that type of a project, I think it's really important. And it doesn't have to be a 5 or 6 year long, super comprehensive and expensive project. They can be challenging projects to do, but it can be a scan. We're going to be doing assessments for 30 or 40 years moving forward. So it's really useful to start. It's really useful to start getting the information together. And I think that's your best source of information to start identifying these indicators.
Thank you. Okay, shifting gears slightly, what do you see the role of standards having with this area of building and sustaining climate resilient healthcare systems? Do you see standards playing an important role?
Well, I think they certainly can, and I think there is interest in some of the standards organizations in Canada, and there's already some activity in terms of looking at climate change and what that might mean for future standards. So certainly, people that work in this space are really looking at this. And so, it could be in terms of when we learn about vulnerabilities or future climate change impacts on the health system, various components of the health system. That may be one option in terms of that kind of thing. One area that Health Canada is quite active in right now, if you're not aware, is looking at indoor temperatures and identifying, when is it too hot indoors? Because we know that most people die indoors from extreme heat events. And so, can one identify maximum temperature thresholds that then could inform, guidelines or standards? And we've done quite a bit of work with Dr. Glenn Kenny at the University of Ottawa and others to identify, what are some of these thresholds that are really important for health. And so, sort of moving towards being able to use different kinds of policy or program measures to really protect health. So certainly, I think this will be an important kind of area to look at in the future.
Okay, thank you. I also just noted a question about another resource. So you mentioned the Health Canada workbook, that you would send the link for that. I'm also going to offer that we can make a few links available because someone has asked for the WHO 2022 document that you referred to. So just confirming that we'll be able to share that as well.
And just to my presentation actually has a reference list, just so people know. And so I've got all of the links. When you receive the presentation, you'll have all of the web links to all of these documents. I think I've made it slightly confusing because there's a few documents that have the same dates, but I'll trust that you'll have equal interest in both of the documents and go and have a look at this. But yeah, you'll receive that with the presentation. Otherwise, just contact me if anything's confusing.
That's fantastic. Thank you. Thank you for making that information so much at our fingertips. Oh, okay. So another question. There are so many climate change and health assessment tools out there. It can be a bit overwhelming for someone who's just entering this area. Do you have a recommended tool to use for a regional assessment? This would be assessment that's more localized, but has more than one municipality, so multiple cities involved.
Yeah, so I think that's a great question because I've been involved in contributing to some of the WHO guidance on health facilities, on undertaking assessments, the recent one on measuring climate resilience of health systems, and I there's a lot of guidance now, and so that's really good because then there's a lot to pull from, but it can be a bit overwhelming in terms of where does one start. I do think that the Health Canada workbook is a really great resource because it's Canadian specific. So it has, I believe, the examples of data sources that are relevant to Canada, but also those fillable templates that I mentioned. So it'll go through the different steps of undertaking assessment and provide really concrete advice in terms of the kinds of indicators that might be helpful to you, the kinds of data sources that might be helpful to you. And certainly, in terms of, I think it's a really important point about how do you undertake an assessment in different kind of the levels of jurisdictions, or it's a region. And I've heard that from, Health Adapt partners, where they'll have, rural areas, they'll have urban areas, and how does one kind of sort of map your way forward in terms of undertaking assessment. And so, I think one of the important things that they have done is really engage with stakeholders and engage with partners and the scientists. And so the first step in undertaking assessment, you see in all of these guidance documents, is scoping the assessment. So it's really figuring out what are the key hazards that you're going to look at. What's the geographical sort of space that you're going to look at, the time frame. Really foundational questions that really scope your assessment. And you can't really do that if you don't talk to a fair number of people actually and get views on what's possible in the time frame that you want to use. What do you have data on? Where do you have expertise? You have to draw from experts as well. And I think if you do a good job of scoping your assessment, then you'll start answering those questions in terms of how do you what's the best way to approach it in terms of these different kind of geographical areas. And certainly our office is quite happy to provide input anytime a partner might find that to be of benefit. We also have a community of practice through our sort of former Health Adapt program, that if you're not part of that, some experts will do presentations, and I think people can sort of ask for specific topics to be discussed. So that might be of interest as well. And so that's something else, Elena, perhaps I can send a link to that.
Fantastic. It's great to know there's so much happening in this area. And thank you for pointing us to the resources. Okay, next question. We only have a few left. Given the time, it's actually quite perfect. Are there interactive databases available, either globally or regionally, that would help someone look at different indicators and measures related to health and climate resilience more, I think, for an exploratory purpose, for someone to become familiar with the different indicators in use? Anything like that?
Yeah, I mean, I think I think one of the challenges in the climate change and health field, um, previously it was that there just wasn't enough information for the longest time. There wasn't enough guidance. There wasn't enough studies done. And I think increasingly we're sort of flipping over in terms of there's a lot more now, and it's sort of a bit like the last question. So and trying to really curate that information and trying to figure out what's most relevant. And so that's a bit of a challenge. I just raised that because there are many different kinds of information that might be of particular interest to you in terms of, like, that's a broad area of climate change and health. And so, one can think of some of the, the climate atlas of Canada in terms of linking sort of, climate data, and then, some of the examples around health impacts. I'm not sure how interactive that is in terms of the depth of data that's there, but there are different kinds of databases. So, I mean, if you wanted to contact me, and if you have a specific area, I think that would be of particular interest, I'd be happy to, if I don't know of something that might be of interest, to try and seek some of that from colleagues in the office. But I think more and more this is being made available. So, the Climate Health Portal, I think, has links to databases, international databases that can be very useful in that regard. So it really depends on, I think, what angle you have on that.
Okay, thank you. Rounding it out. So for this question, it's a two-part question. And so I'll ask you to answer the first part, and then the second part is to PHO. So I'll answer that part. Are you aware if there are any specific initiatives at the national or provincial level to operationalize indicators in a standardized way? And so when we think about indicators, I think one of the first things many of us think of is standardization, something that would provide data for a local health authority level, for example, something, like heat-related illness as an indicator, or metrics of inequality, something that could be added to health indicator monitoring that's currently done by Statistics Canada or Hi, apologies. Yes, are you aware of anything like that in the works?
Well, I mean, a couple of things that we're involved in, and because I certainly wouldn't know the scope of things that are out there at all levels, but certainly the national adaptation strategy, I think, is going to be a really important mechanism to start thinking about how do we measure the targets under the adaptation strategy, and with indicators, for example. And so I think a lot of partners will learn a lot through that process. One of the things that I think would be really great, and we're just starting to think about the next national climate change and health assessment, is whether or not we could actually, because the previous assessment actually looked at some of the frameworks around health system resilience, could we actually start measuring the resilience of health systems in Canada in the next assessment, like actually put data to some of these indicators? And so, that's something I'm certainly thinking about. And so that might provide that opportunity with all levels of partners to really dig into that a bit more.
Fantastic, thank you. And the second part of that question, which actually mirrors a few questions I will now try and answer, is what PHO is currently doing on this topic, which is fascinating. Right now, of course, we at PHO know that indicators help drive the work that we do, and especially the work that our 34 public health units do locally across the province. We're very eager to learn more about this area and have it inform future work. But in terms of current activities, the round session is actually one of the first things we wanted to do in this area. And so many of you joining us today may remember that Peter actually gave a talk about a year ago, I think almost exactly a year ago, on building resilient health systems for climate change. And we specifically asked him to come back today to hone in on the measurement, the indicator piece, because of significant feedback our environmental and occupational health team received following that original talk last year. And so, having Peter here today to help show us the global and the national landscape and what's going on is really meant to start the conversation. And certainly we're eager to take on some exploratory work, looking at indicators where we've identified it may be important for our local health units and supporting and advising them in the work they do. And with that, we are at time. So let me again thank Peter for a fantastic talk. There's always so much information in your slides, but you somehow get through them always quickly, which I'm very impressed by. I'd also like to thank everyone for joining us. You will receive a brief anonymous PHO round survey for today's session. Please try to complete this. It does help us improve our programming year after year. To access the past PHO rounds decks, including Peter's deck from last year, or to view upcoming sessions, please go to our website, head to the Education and Events link, and then click on Presentations. With that, thank you again and have a wonderful afternoon.